Today we are going to discuss the various upper limb nerve injuries. First of all, we'll discuss long thoracic nerve. If an injury to long thoracic nerve occurs, it leads to paralysis of serratus anterior. And the condition that happens is called winging of scapula. So what happens in winging of scapula? That if a person pushes against the wall, the medial border of the scapula becomes prominent. So winging of scapula occurs due to paralysis of serratus anterior muscle, which is being supplied by the long thoracic nerve. If this nerve is damaged, it leads to winging of scapula. Then, if there is injury to the thoracodorsal nerve, this nerve is supplying the muscle that is latissimus dorsi. The latissimus dorsi muscle is the one which is also called the climbing muscle. So this affects the climbing, and thoracodorsal nerve is supplying latissimus dorsi. If this nerve is paralyzed, it affects the climbing. Next is the axillary nerve. This is a very important nerve. It winds around the surgical neck of humerus. So if there is fracture of surgical neck of humerus, or there is improper administration of intramuscular injection in the deltoid region, it leads to paralysis of axillary nerve. So if axillary nerve is damaged, the rounded contour of the shoulder, which is formed by deltoid, is lost, because this is supplying deltoid. Axillary nerve is supplying deltoid. If axillary nerve is damaged, either due to fracture of surgical neck of the humerus around which it is winding around, or if there is improper administration of intramuscular injection, the deltoid, the supply to deltoid is hampered, and it leads to the loss of rounded contour of the shoulder plus loss of sensation over the upper arm, because it is all the cutaneous supply is also by a branch of axillary nerve. Then we have the radial nerve. If radial nerve is damaged in the radial groove, it leads the action of triceps is not fully hampered, as only the medial head of the triceps is damaged. So there is partial loss of triceps action. And the main thing that happens is called the wrist drop. So what happens in wrist drop? The person is unable to extend the wrist and the fingers at metacarpophalangeal joints. And why does that happen? Radial nerve supplies the extensors of forearm. So when the extensors of forearm are not being supplied properly, what happens is that the extension is lost, and it leads to dropping of the wrist, which is called wrist drop. The next nerve is median nerve. So if median nerve is compressed under the flexor retinaculum, it leads to a syndrome that is called the carpal tunnel syndrome. So what happens in carpal tunnel syndrome is that the median nerve is responsible for supplying the lateral 3.5 fingers and its muscles. So the flexion at the metacarpophalangeal joints, this, and the flexion at the interphalangeal joints, this one. This does not happen. So it leads to the formation of a hand, which is called the hand of benediction. Plus the thenar muscles, this thenar eminence is lost, because these muscles are also supplied by the median nerve. Plus opposition of the thumb also doesn't occur. The medial 1.5 fingers, these are spared, because this part of the hand is supplied by the ulnar nerve. So the position of the hand in median nerve injury is called hand of benediction. The last important nerve which can be damaged in the upper limb is ulnar nerve. So when ulnar nerve is damaged, the ulnar nerve basically is passing between the pisiform bone and the hook of Hamate. So a tunnel is formed over here, which is called the Guyon's tunnel. So when this nerve, the ulnar nerve, is compressed at this level, it is called the Guyon tunnel syndrome, just like the carpal tunnel syndrome. So what are the signs and symptoms of this Guyon's tunnel syndrome is that the position of the hand is called the claw hand. Basically what happens is that ulnar nerve is supplying the medial 1.5 fingers. The intrinsic muscles of the hand, they are weakened, plus the interosseous muscles are also supplied by the ulnar nerve. So the interossei, they are causing adduction. So adduction is lost. When a person tries to adduct, the hand is moved laterally. So when there is Guyon's tunnel syndrome, because of ulnar nerve injury, it leads to formation of a hand which is called the claw hand, in which what happens is that the flexion at metacarpophalangeal joints does not occur, leads to extension here, and the flexion which extension that was occurring here doesn't occur, and there is flexion. So basically there is unopposed action of extensors which leads to formation of a hand which is called the ulnar claw hand. So ulnar nerve injury in the Guyon's tunnel is called Guyon tunnel syndrome. It leads to formation of claw hand. There is loss of adduction and formation of claw hand.